sports medicine is definitely for anybody who participates in activities. And with the popularity of staying active and staying in shape and staying healthy, it applies to anybody who partakes in physical activity. Most of the sports injuries are the extremities, so shoulder, elbow, knee, ankle.
One of the biggest misunderstandings is that most of these injuries may be initiated by the sports, but they're perpetuated by more common activities such as lifting multiple grocery bags, lifting luggage, putting luggage in overhead compartments, or extensive use of a computer or keyboard.
My general rule of thumb is that if you have pain that lasts longer than 2 to 3 days and doesn't seem to be improving with ice and Advil and rest, then you should see somebody. You don't necessarily need to come see somebody right after a run because you have a sore muscle, but if you've iced it and stretched and after a couple of days it doesn't seem to be improving at all, I would definitely see a professional.
The primary first-line treatment is activity modification. The other modalities that we use are anti-inflammatory medications, different types of injections. We put them on a strengthening program, we work on weight loss, and we work on the patterns of activity during their days.
We've gotten quite good at minimally invasive surgeries, almost every body part, shoulder, hip, knee, ankle, where we can take a very small camera the size of a pen tip and then put it into the joint and get a fabulous view and see what's going on. We can even reconstruct ligaments in the knee, in the shoulder, even in the ankle arthroscopically. I would say 80% of sports medicine reconstructive surgery can be done minimally invasively. The whole theory behind sports medicine is to try to keep you doing what you're doing or to get you back as soon as possible. Some people work very hard to get where they're at and have worked up to a regimen, so the last thing you want to do is say stop.
We try to be in tune with what is really important with that patient. If they love tennis or golf or running, we try to allow them to continue with that endeavor, but in a modified fashion.
It may be a change in your activity, but we do want to keep you moving. I deal with 8-year-olds and I deal with 84-year-olds, and it's very satisfying because most people can get back to a level of athletic activity or physical activity, and it's very gratifying.